If you're dealing with Crohn's disease, or know someone who is, you've likely felt the impact it has on daily life. The pain, discomfort, and unpredictability can leave you asking, will I ever feel like myself again? While there's no cure for Crohn's, advancements in biologic treatments have given hope to millions. But like with any powerful treatment, there's a lot to consider. Today, we're breaking down biologics for Crohn's disease, what they are, how they work, and why they are both celebrated and scrutinized. We'll cover how these medications, sourced from living organisms, target your immune system to reduce inflammation. But we'll also dig into what it really means to use these treatments, their risks, and what you should ask your doctor if you're considering biologics as a treatment option. What are biologics? At their core, biologics are medications created using components from living organisms. Imagine the complexity of that. These aren't your typical chemical pills. Instead, biologics are made from substances like enzymes, DNA, or proteins. And they're designed to work at a cellular level to manage inflammation, targeting the parts of your immune system that are overactive in people with Crohn's disease. Biologics have been around for years but have gained particular attention in Crohn's disease treatment. By stopping specific signals that lead to inflammation, they can alleviate symptoms that affect both your gastrointestinal tract and other parts of your body. How do biologics work? Now, let's look at how these biologics work to tame Crohn's disease. The magic of biologics lies in their ability to interrupt different parts of the inflammatory process. Each class of biologics has its own unique way of doing this. 1. Anti-TNF agents. TNF, or tumor necrosis factor, is a protein that promotes inflammation in your body. For people with Crohn's, this protein is in overdrive. Anti-TNF agents, like infliximab, adalimumab, and certolizumab pegol, work to block TNF, reducing inflammation and improving symptoms. 2. Anti-integrin agents. These biologics take a different approach. They work by blocking certain immune cells from reaching inflamed areas in the intestines. Vedolizumab and natalizumab are popular options in this category. 3. Interleukin inhibitors. Then, there's ustekinumab, which targets interleukins. These proteins also contribute to inflammation. By blocking interleukins, this drug helps reduce flare-ups in people with Crohn's. 4. JAK inhibitors. JAK inhibitors, like upadacitinib, work by preventing enzymes known as Janus kinases, JAKs, from sparking inflammation. This treatment can be especially helpful for people who haven't found relief with other therapies. Each of these options aims to target specific points in the body's inflammation process. Think of them as roadblocks on the path to inflammation, preventing your immune system from going into overdrive. How effective are biologics? So, are these medications effective? It's a tough question to answer definitively, as everyone's experience with Crohn's is unique. Some people find relief almost immediately, while for others, it can take weeks to notice an improvement. Studies show that biologics can have a significant impact on Crohn's disease. For instance, anti-TNF agents have been shown to help nearly half of those with Crohn's achieve remission within a year. Yet, it's important to note that success varies widely. While some people respond well, others may find that biologics don't work for them, or the effects lessen over time. What are the side effects? You're probably thinking, this sounds promising, but what about the risks? Like all powerful medications, biologics come with potential side effects. Most of these are manageable, but some can be serious. Common side effects include injection site reactions like redness or swelling, skin rashes and fever, chest discomfort and headaches, dizziness and blood pressure spikes, frequent infections. Although rare, severe side effects are possible. That's why it's essential to work closely with your healthcare provider. Together, you can weigh the risks and benefits, considering your overall health and other treatments you've tried. Are biologics worth the risk? This is the big question, and it's a deeply personal one. The reality is that biologics aren't a cure for Crohn's, but they can lead to remission, helping you live with fewer symptoms and more energy for what you love. If you've tried other treatments without success, Biologics could offer you a new sense of freedom from the daily symptoms of Crohn's. But for some, the side effects might not be worth it. Maybe you've found a level of control with a different treatment, or perhaps the risk of side effects feels too high. The choice to use Biologics is one that should be made carefully, in partnership with your healthcare provider. Will I have to take Biologics forever? A common concern is whether Biologics are a lifelong commitment. The answer is, not necessarily. If Biologics help you reach remission, you may eventually be able to taper off the medication under your doctor's guidance. However, stopping Biologics can increase the risk of Crohn's symptoms coming back. Research shows that staying on biologic therapy reduces the likelihood of relapse within 1 to 3 years compared to those who discontinue treatment. What questions should I ask my doctor? If you're considering Biologics, your next step is to have an open conversation with your doctor. To make the most of your appointment, try asking questions like, what specific benefits can I expect from Biologics? What side effects should I watch for? How long will it take to know if the medication is working for me? Are there lifestyle changes that can help support my treatment? What are my options if Biologics don't work? And don't be afraid to bring a loved one along for support. Managing Crohn's can feel isolating, but with the right questions, you can gain a better understanding of whether Biologics are the right choice for you. Final thoughts: Biologics for Crohn's disease represent a significant advancement in treatment options, especially for those who haven't found relief through other means. While these therapies offer hope, they also require thoughtful consideration. There's no one-size-fits-all solution here. What works for someone else might not be your path to relief, and that's okay. The goal is to explore all your options, gather as much information as possible, and work with your healthcare team to find a treatment that aligns with your needs and goals. At the end of the day, you're the expert on your own body. Listening to your body and asking questions are powerful steps toward managing Crohn's disease and reclaiming the parts of your life that may feel out of reach right now. Remember, Crohn's is part of your life, but it doesn't have to define it. Take control, explore your options, and keep moving forward. Thank you for watching, and please subscribe for more insights on managing Crohn's disease and other health topics. Stay informed, stay strong, and we'll see you in the next video.